ADHD is a neurobehavioral disorder that leads to inattention, impulsivity, and often, not always, hyperactivity.
Many people feel that ADHD is only for children, and that's simply not true. Many of the symptoms of ADHD have been present during childhood, such as inattention and hyperactivity. However, many people are able to compensate during that time. But as we get older and the challenges become more evident, such as raising a family, starting a career, running a household, it becomes more of a challenge for people with ADHD, and they find it difficult to juggle several things at one time. They frequently become overwhelmed.
The need for a better solution to adult ADHD has never been greater. In recent years, there's been great advancement in medical technology used to test for adult ADHD. The pairing of qualified, experienced medical doctors with these new technological testing systems is what you'll find in a Focus MD office.
Children who are impulsive are described as aggressive. They often leap before they look. They also have very little patience for things. Whereas adults, they present more as aggressive drivers. They will blurt out answers before the question is often asked, and they have trouble following directions because they just want to get it done. The symptoms of hyperactivity look completely different in children than it does in adults. In children, you have more large movements, such as always running around, jumping, getting into things, unable to sit still. Whereas adults, it's more subtle movements, tapping your foot during a meeting, excessive talking, fidgeting, always having several projects going on at the same time. Although adults can be hyperactive and impulsive, most of the time adults have more inattentive type ADHD. This can be described as often being late, misplacing items, and being very forgetful. Part of the challenge of being a physician is to discover how these childhood manifestations of ADHD present themselves in adulthood. And that is something that we do at Focus MD.
On their own, none of the symptoms of attention deficit disorder are abnormal. Most people feel scattered, unfocused, or distracted at times. Furthermore, the symptoms of ADHD are easy to confuse with other problems, including learning disabilities, anxiety, depression, and emotional issues. Each require totally different treatments. That's why it's important to determine if symptoms really point to ADHD. However, there is no single medical, physical, or other test to diagnose ADHD. That's why here at Focus MD we use the QB test, which is an FDA-cleared computer-based test that measures the core symptoms associated with ADHD, including hyperactivity, impulsivity, and inattention.
From a medical standpoint, the symptoms of ADHD can contribute to such conditions such as anxiety, depression, overeating, substance abuse, chronic pain, or chronic stress.
An ADHD diagnosis may feel like a label, but it's more helpful to think of it as an explanation. The diagnosis explains why you've been struggling with things like paying attention, following directions, listening closely, and organization. It's why a diagnosis of adult ADHD can be an enormous source of hope and relief. It helps you understand what you're up against for the first time and realize that you're not to blame. The difficulties you have are symptoms of ADHD, not the result of personal weaknesses or a character flaw. Also keep in mind that an ADHD diagnosis doesn't mean you're in for a lifetime of suffering. Some people have had only mild symptoms while others experience more pervasive problems. Regardless of where you're in child land on the spectrum, there are things that you can do to manage your symptoms. Many people equate ADHD treatment with medication. It's important to understand that medication doesn't work for everyone, and even when it does work, it won't solve all problems completely or eliminate symptoms. In fact, while medication often improves attention and concentration, it typically does very little to help symptoms of disorganization, poor time management, and forgetfulness. At Focus MD, medication management involves more than just taking a pill and forget about it. You or the doctor will monitor side effects, keep tabs on how you're feeling, and adjust the dosage accordingly.
Medication is not the only treatment for ADHD. Here at Focus MD, we try to encourage individuals to pursue other avenues of treatment, such as daily exercise, improving their diet, multivitamins, some relaxation tips such as meditation or yoga, and also some ADHD coaching we found to be beneficial. However, if an individual does feel that they would like to start medication, they would like them to understand that they do not have to take it every day for the rest of their lives. Once they learn to internalize the strategies that are taught, then they can sometimes decrease the dose or even wean off.
Improving the lives of patients with ADHD is our passion. We know the frustration. We're committed to helping our patients find focus.